Okay, good day, everyone. Today's journal, couldn't think of it, sorry, but today's journal for Introduction to Health and Wellness is How to Be Smoke-Free, Creating Change in Ourselves and the Workplace. In the in our text, the question was, define the major health risks associated with cigarette smoking. Preventable death and disability. Smoking tops the list of the most preventable deaths. Toxic substances such as nicotine, tar, and carbon monoxide are in cigarette smoke. According to the Center for Disease Control, cigarette smoking has caused an estimated 12 million deaths since the first Surgeon General report on smoking in 1964. Inducing organ injury. Previous studies have demonstrated that cigarette smoking may have numerous adverse effects on the body, including organ injury, for example, chronic obstructive pulmonary disease, otherwise known as COPD, hepatitis, pancreatitis, and asthmatic heart disease, and atherosclerosis, which can lead to heart attack, stroke, or even death. Exacerbated risk of cancer. Smoking-associated cancers and other illnesses accounted for well over 440,000 deaths annually in the United States. Studies published since 1986 IARC monograph on tobacco smoking provided sufficient evidence to establish a causal association between cigarette smoking and cancer of the nasal cavities and paranasal sinuses, nasopharynx, stomach, liver, kidney, and uterine cervix, and for endocarcinoma of the esophagus and myeloid leukemia. Increased mortality rate. According to the Center for Disease Control, the overall mortality among both male and female smokers in the United States is about 3 times higher than that among similar people who never smoked. Health benefits of smoking cessation. Reduced risk of mortality among patients, heart disease, and as noted in the 2007 current cardiovascular risk report it was estimated that there were a 36% reduction in risk of mortality after approximately 3 to 5 years. Decreased morbidity. When people stop smoking, their risk of developing heart disease and some kinds of cancer, if not already present in the body, eventually decreases to that of non-smokers. Improved quality of life. Once an individual stops smoking, their physical function improves. They will experience less pain and more vitality, increased stamina, endurance, and confidence. Their lung function improves so they can breathe better and be more active. They sleep better, they have less stress, manage stress. Have less or better manage of stress. Quitting smoking results in benefits that begin immediately and become more significant the longer a person stays smoke-free. Explain the impact of a smoke-free environment for all employees on wellness. Benefits of. According to the CDC, smoking costs a total of $82 billion in indirect costs from lost productivity because smokers are more likely to be absent from work than non-smokers. Benefits to having a smoke-free workplace other than the billions of dollars saved, including boosting morale by creating a healthier, safer workplace. By doing this, you will lower other employees' exposure to secondhand smoke and the associated illness and disabilities associated with the exposure. Sorry, that was that one. Explain how behavior change theories can be used to evaluate a person's readiness to quit smoking. Whether you have been smoking for a few months or several years, smoking is an addictive behavior that requires someone be ready to make a change to better themselves. In our text, we learned about the trans-theoretical model of behavior change that details the 6 stages of change to include pre-contemplation, contemplation, preparation, action, maintenance, and determination. It is important not to try to skip or rush through any of these stages. Successful behavior changes do not typically happen all at once. It takes time. There are assessment models or questionnaires that an individual can ask themselves to determine their readiness to quit smoking before progressing through these stages. The assessment activity 11-3 found on page 395 of our text is a valuable source to use to assess your feelings towards smoking and optimistically guide you into the first stage of behavioral change model. Pre-contemplation, the higher your score of 15 is the highest, the more important a particular factor is in your smoking and the more useful the discussion of that factor can be in your attempt to quit. In the pre-contemplation stage, in order to motivate change, you have to encourage consciousness. Providing the individual with the questionnaire listed in the previous slide can provide information about specific health practices and behavioral tendencies that can be targeted for change, particularly smoking. Contemplation stage, in the individuals consciously aware of the need to change but haven't put in plans in motion or performed any action of change. In this stage, it is important to expose the smoker to information about various negative aspects of smoking and force them to imagine the consequences to their health and wellness if their behavior doesn't change. Preparation is when the planning really kicks into gear with a potential set date of within 30 days. In this stage, a firm, detailed plan is developed that involves 1. Assessing behavior, and 2. Setting specific, realistic goals. During this stage, you can motivate the individual by assisting them in creating those specific, measurable, accurate, realistic, and trackable goals. During the action phase, there is a commitment to change. Steps are actually being taken to quit smoking. A particular motivating factor to utilize during this change is the establishment of rewards. Rewards and incentives are important elements of this stage. Promoting the change during this phase also includes removing the trigger or changing the environment. Someone trying to quit smoking won't find much help trying to quit while hanging out in a bar or hanging out with friends who still practice the behavior they are trying to change. In the maintenance phase, you have to continue to do the work. Motivation includes reminding them of the plan, continue to help them avoid the behavior, and encourage them to participate in support groups. Finally, in termination, the smoking is no longer an issue. The individual is no longer tempted. The termination stage is the ultimate goal for people trying to make a lifestyle change. It is important to take note of signs of relapse. During this phase, you may also have to consider changing the rewards or reshaping goals. Health behavior is influenced by many complex forces, including family, role models, and social pressure, advertising, and psychological needs. Role models provide inspiration for change. Role models also influence the positive lifestyle habits of others. Describe 2 smoking cessation aids. 2 of the most popular smoking cessation aids are nicotine-containing gum and nicotine transdermal patches. The chewing gum is normally prescribed by a physician at a dose of around 2 to 4 milligrams of nicotine per piece of gum. When used under physician's guidance, the success rate is about 40%. Quitting is not cheap, though. You can expect to pay $50 initially for the first dose, and subsequent refills can cost around $30 a pop. When a single pack of cigarettes runs for anywhere between $5 and $10, it may become a deterrent when your sensation aid becomes more expensive than the object you're trying to refrain from. The patch, on the other hand, is much less effective and roughly 25% useless. It's combined with prescribed medications like mecamylamine, then it rises to approximately 40% while the costs are roughly the same. The side effects are much worse when using the patch than when when compared to the gum. The gum may cause mouth ulcers and nausea, but the patch can cause skin irritation and in some instances can trigger an irregular heart rate. It is strongly recommended whichever option you choose, you are under the supervision of a medical practitioner. Here are the references in which I got all my information from for this journal. Again, this is my journal for how to be smoke-free, creating change in ourselves and the workplace. For my class HWE 200 Introduction to Health and Wellness. Again, thank you.